Hello and welcome to Rajya Sabha TV. I'm Tina Jha with News Tonight, where we try and get you all the significant news and updates from across India and the world. The government on Tuesday launched its one-stop database of COVID-19 volunteers in the country. The online data pool comprises of details of all volunteers and of all designated hospitals to tackle COVID-19 cases in the country. The COVID-19 warriors will be involved in preventive activities like supply of essential commodities in the containment zones and also in carrying out field surveillance programs. The data can be accessed through covidwarriors.gov.in.
स्टेट लेवल कोऑर्डिनेटर्स उनके टेलीफोन नंबर्स, डिस्ट्रिक्ट लेवल कोऑर्डिनेटर्स उनके टेलीफोन नंबर्स, यहाँ तक कि कुछ ऐसे प्रोफेशनल्स हैं, ऐसे कुछ हेल्थ वर्कर्स हैं जिनके कॉन्टैक्ट जो डिस्ट्रिक्ट लेवल पे नहीं केवल फील्ड लेवल पे जो काम कर रहे हैं वहाँ भी वो मौजूद हैं। तो अब तक हमने 20 कैटेगरीज और 49 सब कैटेगरीज इसमें शामिल किया गया है और ये इंडिविजुअल लेवल जो डेटा है वो केवल इंडिविजुअल लेवल डेटा जो है वो डिस्ट्रिक्ट मैजिस्ट्रेट और म्युनिसिपल बॉडीज और स्टेट गवर्नमेंट को कुछ ही लोगों को वो एक्सेस कर पाएंगे और बाकी सब जो डेटा है डिस्ट्रिक्ट लेवल तक वो सारे लोग ये पब्लिक डोमेन में हैं, उनको देख सकते हैं। हमने 201 सेंट्रल पब्लिक सेक्टर एंटरप्राइजेस के जो हॉस्पिटल्स उनके सारे डिटेल्स, डॉक्टर, नर्सेस, पैरामेडिक्स, ये सारे बेड्स, आईसीयूज, वो सब 49 ईएसआईसी के हॉस्पिटल्स, 50 रेलवेज के हॉस्पिटल्स, 12 पोर्ट हॉस्पिटल्स और 13 जो है ऑर्डिनेंस फैक्ट्रीज और हाल के जैसे हॉस्पिटल्स, ये सारे डिटेल्स भी उसमें मौजूद हैं।
According to the Health Ministry, 61 districts in the country have not reported any new COVID-19 case in the last 14 days. This is an increase of 4 new districts since Monday. These districts include Latur, Osmanabad, Hingoli and Washim in Maharashtra. India currently has 15,349 confirmed COVID-19 cases with a recovery rate of 0.17%. With over 4,000 COVID-19 cases, Maharashtra continues to report the highest number of infections, followed by Delhi and Gujarat.
लोग जो हैं वो क्योर हो चुके हैं। कल सबसे ज़्यादा संख्या में 705 लोग रिकवर हुए हैं, क्योर हुए हैं एंड इट टेक्स आवर रिकवरी परसेंटेज टू 17.48%। कल से टोटल 1,336 एडिशनल कंफर्म केसेस आए हैं विच टेक्स आवर कंफर्म केसेस टू 18,601। इससे पहले जैसे हम लोगों ने बताया है कि 3 डिस्ट्रिक्ट थे जिस पर पिछले 28 दिनों से केसेस नहीं आए हैं, उसमें एक और नया जिला अब प्रतापगढ़ इन राजस्थान ऐड हुआ है। इसके साथ ही टोटल 61 डिस्ट्रिक्ट्स हैं देश में, 23 स्टेट्स और यूनियन टेरिटरीज में, जहां पिछले 14 दिनों से कोई केस नहीं आया है। जो 4 नए जिले इसमें ऐड हुए हैं वह हैं लातूर, उस्मानाबाद, हिंगोली, वाशिम महाराष्ट्र से। इसके साथ ही भिवानी एक जिला था जो पहले हमारी लिस्ट में था जिसमें पिछले 14 दिनों से केस नहीं आए थे, वहां पर केस रिपोर्ट हुए हैं। हॉस्पिटल्स में ऐसे इश्यूज की मॉनिटरिंग के लिए हॉस्पिटल इन्फेक्शन कंट्रोल कमेटी को रेस्पॉन्सिबल बनाया गया है। यह कमेटी इंश्योर करेगी कि उस हॉस्पिटल के हेल्थ केयर वर्कर इन्फेक्शन प्रिवेंशन और कंट्रोल गाइडलाइंस पर प्रॉपरली ओरिएंटेड हों। कोई भी अगर पॉजिटिव केस आता है उस हॉस्पिटल में तो वह लोकल हेल्थ अथॉरिटीज़ को सूचित करें और पेशेंट को उसी हॉस्पिटल के प्रॉपर आइसोलेशन वार्ड में ट्रांसफ़र करें। अगर ऐसा कोई पेशेंट पाया जाए तो उसको इमीडिएटली मास्क लगाया जाए और एक डेडिकेटेड हेल्थ वर्कर ही उस केस को अटेंड करे और जब वह अटेंड करे तो वह भी रिक्वायर्ड प्रिकॉशंस ले। साथ ही बेस्ड ऑन क्लिनिकल स्टेटस अगर ज़रूरत है तो इमीडिएटली उस पेशेंट को स्टैंडर्ड प्रोटोकॉल के तहत उसको डेडिकेटेड कोविड फैसिलिटी में ट्रांसफ़र किया जाए।
Meanwhile, the ICMR has advised all states not to use new rapid antibody tests for 2 days, saying it will investigate the issue of faulty kits based on a complaint regarding low detection.
अगले 2 दिन में हम हमारे 8 इंस्टीट्यूट्स को फील्ड में भेजेंगे और जो किट्स हैं उनमें से वो लॉट्स लेके उसको टेस्ट करके वैलिडेशन करने की कोशिश करें। फील्ड में वैलिडेशन होगा, ये लैब में नहीं होगा। दूसरी बात हमको एक करना है कि सारे स्टेट्स को ये सलाह देना है कि अगले 2 दिन ये टेस्ट किट्स इस्तेमाल न करें। 2 दिन के बाद में हम क्लियर कट एडवाइजरी देने के पोजीशन में रहेंगे, क्योंकि अगर ऐसे कुछ नज़र आया कि वो बैचेस में प्रॉब्लम है तो हम वो बैच को रिप्लेसमेंट के लिए वो कंपनी को बोल सकेंगे। इसलिए सबने इस वक्त तो भी वो टेस्ट किट इस्तेमाल 2 दिन ना करें, और अगले 2 दिन में हम जो भी सही जो रिजल्ट्स आते हैं वो आपको बताएंगे।
ICMR has advised all the states and UTs that not to use this antibody rapid test kits for next 2 days, says it will investigate it further and will release the report accordingly. These are the test kits which are brought in from the 2 international companies. Around 5 lakh these test kits were brought in and were distributed to the states. Anu Diwan for Rajya Sabha TV.
The inter-ministerial team formed by the government has reached the states of West Bengal, Maharashtra, Rajasthan and Madhya Pradesh to assess the COVID-19 situation in these states.
इंटर-मिनिस्ट्रियल सेंट्रल टीमों को 4 राज्यों में डिप्लॉय किया है। महाराष्ट्र, मध्य प्रदेश, राजस्थान में इन टीमों को अपने कार्यों में राज्य सरकार का भरपूर सहयोग मिल रहा है, परंतु गृह मंत्रालय को यह फीडबैक मिला कि पश्चिम बंगाल में जो टीमें कोलकाता और जलपाईगुड़ी गई हैं, उनको राज्य सरकार और स्थानीय प्रशासन से सहयोग प्राप्त नहीं हो रहा है। उनको क्षेत्र का विजिट करने से रोका जा रहा है। उनको राज्य में स्वास्थ्य कर्मियों से इंटरैक्ट करने का अवसर नहीं दिया जा रहा।
We have been deployed here by the central government. We came here yesterday, and our order of deployment also says that the state government is to provide logistic support to us. The team comprises of officers from the NDMA, public health specialists from Department of Health and Department of Consumer Affairs. So it is a wide-ranging team which would have provided support to the state government for the COVID purpose, and also have a look at the situation prevailing in the area. We have been in touch. I have been in touch with the Chief Secretary since yesterday, since the time I landed, seeking support from the state government to visit the areas. We also met the Chief Secretary last evening at 6 p.m. at Navarna, where we were assured that today we will again have a meeting and we will be going out for taken around. But today we were informed that there are some issues and we will not be going out.
On Tuesday, Delhi Chief Minister Arvind Kejriwal and Lieutenant Governor Anil Baijal held a meeting with district collectors and the deputy commissioners of police of all districts via video conferencing. During the interaction, Baijal advised officials to ensure effective management of containment zones, food centers and also night shelters. In a Twitter message, he said the health department is planning rapid testing for frontline workers and the vulnerable population. The Aam Aadmi Party government also announced that the Azadpur wholesale market will remain open round the clock from Tuesday. This is to ensure enough supply of vegetables and fruits in the national capital. Meanwhile, the total number of positive cases in Delhi rose to 2,081. Taking a cue from Maharashtra, the Delhi government has decided to conduct tests on all media professionals. On the other hand, Rajasthan has stopped rapid antibody tests after a team of experts questioned their use on the basis of results from confirmed COVID-19 cases. The state has now sought guidance from the Indian Council of Medical Research. The state reported 98 new coronavirus cases on Tuesday morning, bringing the total reported cases to 1,576. Of these, 205 have recovered and 25 have passed away. In Odisha, taking a firm stand against people mistreating corona warriors, Chief Minister Naveen Patnaik said that any act against health professionals will be considered an act against the state, inviting strict criminal action and even provisions of National Security Act.
The state government, in convergence with the Government of India initiative, will ensure that rupees 50 lakhs is given for all health personnel, both private and public, and members of all support services who lose their precious lives in the fight against COVID-19. The state will treat them as martyrs and will provide state funerals with state honors. Please remember that any act against them is an act against the state. In case anyone indulges in any act that will disturb or dishonor their work, very strict criminal action will be taken against them, including invoking the provisions of the National Security Act.
Maharashtra continues to lead the coronavirus tally with 466 fresh cases and 9 deaths. In Pune, 25 paramedics, including 90 nurses of the city's Ruby Hall Clinic, tested positive for novel coronavirus. Pune is one of the 14 COVID-19 hotspots in the state. In Gujarat, the total number of COVID-19 cases crossed the 2,000 mark on Tuesday, with 127 fresh cases reported in the last 15 hours. Meanwhile, Ahmedabad-based Sardar Vallabhbhai Patel Institute of Medical Sciences and Research became the first authorized study center in the country to carry out plasma research under trial in view of COVID-19. In Andhra Pradesh, the COVID-19 positive cases have jumped to 757. 96 patients have been discharged after recovery and 22 have died so far. Efforts are on to increase testing at hotspots and red zone areas in the state.
विभिन्न जिलों की लॉकडाउन की स्थिति की ग्राउंड लेवल पर समीक्षा के दौरान यह सामने आया है कि कई सेक्टरों में जहां 20 अप्रैल से अतिरिक्त गतिविधियों को अनुमति प्रदान की गई थी, वहां पर अच्छी शुरुआत हुई है। कई स्थानों पर ग्रामीण क्षेत्रों में औद्योगिक गतिविधियां शुरू हुई हैं। मनरेगा के तहत भी कार्य शुरू हुए हैं। कुछ राज्यों में सड़क निर्माण का कार्य भी शुरू किया गया है। ईंट भट्टों का संचालन भी आरंभ हुआ है। प्रवासी मजदूरों को इन गतिविधियों में शामिल किया जा रहा है। हमें ये भी जान के खुशी हुई है कि ग्रामीण लोग जागरूक हैं और कई स्थानों पर मास्क और गमछा पहन रहे हैं।
The Rashtrapati Bhavan on Tuesday released a press statement on media reports and speculation over the detection of a COVID-19 positive case in the President's estate. The statement made it clear that till date, no employee of the President's Secretariat has tested positive for COVID-19 and preventive measures are being taken. The statement said that a family member of an employee of the President's Secretariat had come in contact with a COVID-19 positive patient from central Delhi who passed away on the 13th of April. All 7 members of this family were moved to a quarantine facility on the 16th of April, after which one of the family members tested positive. All other family members, including the employee, have tested negative. Lok Sabha Speaker Om Birla has suggested that Parliament as well as state assemblies must adopt technology in order to function more effectively.
Om Birla said this in an interaction with presiding officers of state legislative assemblies via video conferencing at Parliament House on Tuesday. He urged assemblies to explore the feasibility of extensive use of digital technology in legislative and financial work. Praising the efforts of the central and state governments to combat the COVID-19 pandemic, the Lok Sabha Speaker said they had been vigilant and have taken timely and necessary steps to contain its spread. He noted that mutual synergy and excellent disaster management efforts have allowed India to minimize the damage from this disease. Stating that the situation is largely under control, Birla said the government is fully prepared to meet any challenges. He informed that 4 committees of presiding officers that had been constituted earlier to look into the matters relating to disruptions in the House, autonomy of legislatures, 10th schedule of the Constitution and IT have made substantial progress in finalizing their reports. He said the committees will submit the reports in due course.
नई परिस्थिति में अधिक से अधिक इंटरनेट का उपयोग हो, वीडियो कॉन्फ्रेंसिंग का उपयोग हो, ताकि हम अपनी सभी गतिविधियां भौतिक और वर्चुअल मिश्रण करके सही तरीके से चला सकें। आपको विदित है कि हमने 4 महत्वपूर्ण समितियां गठित की थी और उन समितियों ने काफी हद तक अपने कार्य को पूरा भी किया है। हम नियमित रूप से इस समय उन समितियों के माध्यम से अपने महत्वपूर्ण कार्य को पूरा कर विधायी कार्य में किस तरीके से नए बदलाव हो सकते हैं, उसकी भी चर्चा आपस में करें।
On India's efforts to assist the rest of the world in its fight against the pandemic, Birla said whenever possible, India has tried to help other countries with medicines and essential equipment. In his interaction with the speakers of state assemblies, Birla was informed that many states had taken proactive measures to provide relief to affected people. He was informed that many state MLAs had actively contributed to COVID-19 relief funds, both at the central as well as state level. Om Birla also called upon all the state assemblies to set up a control room for real-time information exchange between the various state assemblies and parliament.
India has pitched for enhancing the emergency assistance of New Development Bank to $10 billion from $1 billion to fight the COVID-19 pandemic.
Happy to note that
Addressing the 5th annual meeting of the Board of Governors of NDB via video conference, Finance Minister Nirmala Sitharaman appreciated their efforts to fast-track financial assistance of about $5 billion to BRICS countries, including emergency assistance of $1 billion to India. She also talked about Prime Minister Modi's initiative of creating a COVID-19 emergency fund and India's efforts in supplying critical medicines to other countries to tackle COVID-19. Sitharaman also outlined various measures taken by India in response to the pandemic, including allocation of 15,000 crore rupees for strengthening the healthcare system. She also encouraged NDB to take appropriate actions to join G20 forum along with other multilateral development bank and international financial institutions. BRICS countries established NDB in the year 2014.
Happy to note that the bank has the financial capacity to enhance the emergency facility up to $10 billion for crisis-related assistance. Therefore, based on the demands from the member countries, this facility should be enhanced. Further, I strongly encourage NDB to take appropriate actions to join the G20 forum along with other multilateral development banks, international financial institutions and so on.
Today is Civil Services Day, a day when President Ramnath Kovind, Vice President M. Venkaiah Naidu and Prime Minister Narendra Modi praised the contributions of civil servants, especially in India's fight against coronavirus pandemic.
In a Twitter message, President Kovind said that civil services are playing a key role in implementing the policies and programs for public welfare. Calling civil services the steel frame of India, President Kovind said that civil servants have shown their mettle and resolve in handling the COVID-19 situation. Vice President Naidu called civil servants Karuna warriors. In a series of messages on Twitter, he complimented them for the manner in which they have led the fight against the COVID-19 pandemic along with the doctors and medical professionals. The Vice President expressed confidence that the experienced and able civil servants will help the nation win its battle against the coronavirus. In a newspaper article, the Vice President also appreciated the efforts made by the civil servants in flawlessly using the administrative machinery across the country in executing the lockdown. He said, "Our civil services have stood between the virus and the safety of our people, calling it their crowning moment." Prime Minister Narendra Modi also appreciated the efforts of civil servants in ensuring that India successfully defeats COVID-19. He said the officers are working round the clock, assisting those in need and ensuring that everyone stays healthy. The Prime Minister also paid tributes to Sardar Vallabhbhai Patel, who envisioned India's administrative framework.
273 Lifeline Udan flights have delivered 463 tons of essential goods amid the nationwide lockdown since the 25th of March. Operated by the Ministry of Civil Aviation, these flights transport essential medical cargo to remote parts of the country to deal with the COVID-19 pandemic. 274 flights have been operated under Lifeline Udan by Air India, Alliance Air, Indian Air Force and private carriers. Helicopter services have been operating in Jammu and Kashmir, Ladakh, Andaman and Nicobar Islands and the Northeast region, transporting critical medical cargo and patients. Cargo hubs have been established at Delhi, Mumbai, Chennai, Kolkata, Hyderabad, Bengaluru and Guwahati. Domestic cargo operators SpiceJet, Blue Dart and Indigo are operating cargo flights on a commercial basis. SpiceJet operated 393 cargo flights carrying over 3,183 tons of cargo. Blue Dart operated 134 domestic cargo flights carrying 2,122 tons of cargo, while Indigo has operated 29 cargo flights so far, carrying around 31 tons of cargo. This includes medical supplies carried free of cost for the government. An air bridge has been established for transportation of pharmaceuticals, medical equipment, and COVID-19 relief material, through which over 207 tons of essential goods have been brought to India from other countries. After taking oath as Chief Minister of Madhya Pradesh on the 23rd of March, Shivraj Singh Chauhan inducted 5 ministers in his cabinet on Tuesday. Narottam Mishra, Tulsi Silawat, Kamal Patel, Govind Singh Rajput and Meena Singh were sworn in as ministers. Governor Lalji Tandon administered them the oath of office in the presence of Chief Minister Shivraj Singh Chauhan. During the swearing-in ceremony, all precautions including social distancing were taken in view of the coronavirus infection. The swearing-in program was broadcast live on YouTube channel of the State Public Relations Department to avoid large gathering. Chauhan took oath as the Chief Minister following the resignation of 22 Congress MLAs that led to the fall of the Kamal Nath-led Congress government in the state last month. And after touching $0 for the first time ever, oil prices on Tuesday recovered some lost ground from a historic crash.
On Tuesday, US oil started trading at $1.10 a barrel after it closed at minus $37.63 a barrel in New York on Monday. It was the first time ever in history that the price of US oil had turned negative, which meant that oil producers were paying buyers to take the commodity off their hands over fears that their capacity to store further supplies could run out by May. Demand for oil has all but dried up as lockdowns across the world have kept people inside. US oil firms have resorted to renting tankers and finding other options to store surplus supply. In the absence of demand, the oil supply is a source of concern, despite the OPEC and allies recently deciding to reduce output. The deal was expected to stabilize prices, which it failed to do. The low price could mean a respite for an oil-importing nation like India, but not immediately and also not to the extent that prices have fallen. India imports about 82% of its required crude, which accounts for over 20% of India's merchandise imports. The low oil prices are expected to turn the country's current account deficit, or the difference between inflow and outflow of foreign currency, positive. But for India, the lower prices will not mean an immediate fall in domestic prices, mainly because Asian currencies, including the rupee, are trading weaker against the US dollar. The rupee-dollar difference may offset gains from lower oil prices. India largely imports Brent crude from the OPEC bloc. Brent comes from the North Sea near Norway. So while it is the price of West Texas Intermediate crude that has fallen because of storage problems, the heart of the US pipeline network in Oklahoma, Brent prices continue to be stable in the current situation. Also, the most popular retailed oils in India, petrol, diesel and kerosene, are all refined oils that adds cost.
Well, today was probably one of the most historic days we've ever seen on the CME or NYMEX, with prices falling as low as minus 35, minus 40. Crude has never gone negative, and today we went negative in a major way. And again, this one I think is one of the most historic days since crude started trading back in the early 80s.
The market views the current situation of supply-demand imbalance, where there's too much supply. The market regards that as a temporary condition, but we haven't probably seen quite the bottom in oil yet. We think we're close, but we haven't quite seen it yet.
The World Health Organization has reiterated that lifting of lockdowns to contain the spread of coronavirus pandemic must be gradual.
The global health body warned that if the restrictions are relaxed too soon, they could trigger a resurgence of infections. At an online press conference, a WHO representative said lockdown measures have been effective and people must be ready for a new way of living to allow society to function while the coronavirus is being kept in check. On Monday, the Director General of WHO said the world needs to come together to overcome the COVID-19 pandemic. Speaking at a virtual press conference in Geneva, the WHO chief warned that without global solidarity, the worst is ahead of us. Meanwhile, US President Donald Trump said he will sign an executive order to temporarily suspend immigration into America. The coronavirus outbreak has killed more than 40,000 people in the US and more than 750,000 cases have been confirmed according to a Johns Hopkins University tally. Singapore recorded its highest daily jump on Monday with 1,426 new cases. Its Prime Minister Lee Hsien Loong said on Tuesday that partial lockdown measures to stem the spread of coronavirus in the country will be extended by 4 weeks till the 1st of June. The announcement comes 2 weeks after the city-state imposed so-called circuit breaker measures that closed schools and most office places. Social gatherings are banned and only essential businesses are allowed to operate. After the United States, Spain is the second country with the most cases of COVID-19. It has imposed one of the strictest lockdown measures in Europe. On Tuesday, its health ministry announced 430 deaths in the last 24 hours, taking the total number of deaths to 21,282. Over 204,178 people have been infected and at least 82,514 people are registered as having recovered. Meanwhile, France on the 20th of April officially registered more than 20,000 deaths from coronavirus infections. It is now the fourth country to go beyond that threshold after Italy, Spain, and the United States. French Public Health Chief Jérôme Salmon said coronavirus-linked fatalities were up 2.8% at 20,265, against an increase of 2% from the 19th of April. Hospital deaths account for most of the fatalities at 12,513, while those in nursing homes account for 7,752 of the total. But the numbers in intensive care fell for the 12th day in a row, suggesting that more than a month-old national lockdown is having positive effects. France has 114,657 confirmed cases of COVID-19.
And that's it from us on News Tonight. Thank you for your time. Stay home, stay safe. Good night.